Hi, in this video, we'd like to focus on our anti-hospital specialization, which is recurrent miscarriage treatment. Now, recurrent miscarriage treatment has been compiled to be caused by up to 43 or 44 factors that can lead to the same outcome of recurrent miscarriage. Now, in this video, we'd like to discuss uterine factors that lead to recurrent miscarriage. So generally speaking, uterine factors can be separated into two subcategories. So the first subcategory involves congenital uterine factor. Second one is a acquired uterine factor. So congenital factors, generally speaking, the most common types will involve two types. First of all is a uterine septate, which is one of the most common forms of uterine malformation that we see patients have. And then the second one is a naive uterus, which means this type of uterus is also quite common, and it has a smaller uterine volume with an imbalance in the tissue ratio, which means they have more connective tissues. In the acquired factor, uterine factor, there are also generally two subcategories. So the first one is uterine fibroids. So generally fibroids are not something that you are born with. It is due to a hormonal imbalance and also several other factors that will lead to an eventual development of this uterine fibroid. The second one is adenomyosis. So these two acquired uterine factors lead to a recurrent miscarriage because they compete oxygen and nutrients with the pregnancy. Now, when the pregnancy doesn't have sufficient nutrients, oxygen, it will not develop well, and generally speaking, it will lead to a stillbirth or recurrent miscarriage. Even if the baby manages to survive, the pregnancy has been sustained full term, this baby may be deformed or has several deficiencies and also deformities. So for uterine factors, diagnosis is key, treatment is key. It is very simple to prevent recurrent miscarriage. All we need to do is have the patient to go for a full systemic checkup and diagnosis before any types of pregnancy. But this is our biggest advice that we can give to any couples who are having a wish of starting a family, to avoid any pregnancy complications. Uterine factors can be eliminated very easily. It's one of the most easily treated factors as long as we do a diagnosis and a prevention treatment. So for a naive uterus and also septate uterus, generally we will use cold knife separation for treatment to remove these excess tissues to restore a healthy uterus shape, and then we will also use a pear-shaped stent along with our bioadhesion barrier to promote healing. So generally after a few months, patients, once she is recovered, she will be able to sustain a full-term healthy pregnancy with a healthy baby as well. So for the uterine fibroids and adenomyosis, before pregnancy, if you are diagnosed, we will undergo 3D laparoscopic surgery to remove them. Whether if it's a uterine fibroid or adenomyosis, we will generally use the most effective method, which is 3D laparoscopy. Once they are removed, we will also apply our bioadhesion barrier to promote recovery of the uterus. And maybe 2 to 3 months later, once patient is fully recovered, she can then go for a pregnancy to full term, and also a healthy baby can be had. So generally, uterine factors involve congenital factors and also acquired factors, and all of them needs to be dealt with before pregnancy for the best outcome. If you have more questions about this, please leave me a question below. You can also visit our website for more information.